Hello everyone, and welcome to Chapter 12, Should We Medicate? Our group consists of Sarah, Clarissa, Shauna, Ashley, and Stephen, and I will be guiding you through the presentation and just sort of expanding on some of our key ideas. So, what we're really looking at is whether or not medications, specifically PRNs, should be used when we're supporting people with disabilities. We all have different thoughts and opinions on this as DSWs, but at the end of the day, we always need to do what is best for the individuals we support. Medication has been proven to benefit people with disabilities. Behavior, pain management, and quality of life medications are extremely helpful in many situations. And despite the usefulness of medications, we need to remember that non-medical interventions should always be used first. So these are just some definitions here that might be helpful going through our presentation. A pharmaceutical drug is a medication used to cure, treat, or prevent a disease. Over-medicated refers to when a patient ingests excessive quantities of a certain medication. An adverse effect means an abnormal or harmful result of a medication. An antipsychotic is a type of drug, sometimes called tranquilizers or neuroleptics. They're used to treat psychosis symptoms. A psychotropic drug is a substance that changes brain chemistry, resulting in alterations to cognition, mood, or behaviors. A pharmacist means an educated and licensed individual who dispenses prescribed medications. Just a few more definitions here. Psychologist, an educated and licensed individual who studies other individuals' behaviors, including their cognition. Toxicity is the point at which a substance can become harmful to a human being. Covert refers to discreetly, unknowingly, or hiding medications. Rights means what is morally honorable or legally correct. And refusal is an instance of declining or non-acceptance. So just a few fun facts as we get going here. 35,000 prescriptions for antidepressants are written every year for children under the 18 years of age. There has been a 369% increase in medication and in prescriptions of medications for children with ADHD in the past decade, and 2 or more medications are prescribed to over 40% of youth treated by a psychiatrist. So moving right along, when should we use PRNs? So the first argument we're going to look at today is that PRNs should be used. Under this argument, PRNs can be used in the following situations: when an individual is harming themselves or others, when the safety to prevent a future behavior for everyone around is compromised, for a better quality of life, to assist with pain management, and to maintain good health. So we asked some members of the class what their opinion on this was, and we had quite a few different inputs. We found that argument 1 is valid. People with developmental disabilities should be medicated to allow them to function more effectively in their environment. The understanding that such medication would make individuals more comfortable and happier in life and is necessary to their function is increasingly important and is a decision that is the individual's rights to make. That is what our class found about argument 1. So moving along to argument 2, which is that PRNs should not be used under any circumstances. The reason someone might have this opinion is due to many reasons. They might have religious or cultural reasons. They might prefer alternative strategies before administering a PRN. They can be used as a tolerance, or they might be worried that an individual may become dependent on the PRN. Side effects may be worse than the benefits of the PRN, and they may be mixed with other medication that causes a different effect than the supporter expects. So in terms of argument number 2, when we asked the class, we found that some people do indeed believe that people with developmental disabilities should not be medicated to allow them to function more effectively unless the medication is absolutely needed. If they are receiving the right dose of medication that their body requires, this is fine. But the problem is that medicating them for behavior may be doing it for the benefit of others, not for the benefit of the individual themselves. So our class pointed that out, and it is a very valid criticism. So we'll move along, kind of on the same vein, to how the legal and ethical debate of PRNs affect their medical administration. So the practice of covertly administering medications to patients likely occurs in long-term care facilities. And the ethical issue this brings up is significant. Masking medications in the patient's beverages and meals is a practice that should be viewed from both a legal and ethical lens. This is not to be confused with altering a medication so that it is simpler to take, but hiding the medications for clients, such as PRN medications when suspecting a behavior. So the individual may not know that they're taking a PRN. And this ethical question of whether or not it's right for us, even if someone's safety is at jeopardy, is one that we all need to consider as DSWs. When we look at Canada, the right of an individual with mental capacities to decide treatment options has been passed in provincial and territorial legislation. So the Supreme Court of Canada has said that the security of the person has an element of personal autonomy, protecting the dignity and privacy of individuals with respect to decisions concerning their own body. The problem with this is it can indefinitely only be applied to those who can communicate their consent to administration of PRN medications. The question remains, people who cannot consent verbally to PRN medications, is it ethical for them to be taking them? So let's address what is a PRN exactly. PRNs are to be used when needed. Now this is a fine line between the client's needs and the staffing's wants, which we always need to bear in mind. If the client has a capability to request a PRN themselves, then the circumstances of medical administration are far simpler than a client who is given a PRN by a staff because of a behavior or a worsening behavior. These are the circumstances where overmedication can occur quite easily. Sometimes a client may have been prescribed a PRN of antipsychotic or psychotropic nature, and then the assumption of the staff is that they are the ones to determine when the client needs it, as adverse behaviors are often aimed at staff and other clients in the home. So this puts a lot of power into the DSW and to the person giving out the PRN. So what does this mean for those who cannot speak for themselves in these situations? We deal with a lot of clients who are nonverbal, who do require PRNs occasionally. So generally, alternative measures are put in place for those few people, including the involvement of family members or legal guardians who might be closer to the individual, have a greater rapport with them. For clients who have exceeded the age of 21, their guardians make these executive decisions. In this, the guardian is entitled to make the decision of whether the person receives PRN medications, as well as if the staffing is to decide these types of medications. So in some places, staff are able to administer PRNs as they are needed. In some locations, you need to get permission from a guardian or a parent. So in regards to the DSW Code of Ethics, we should strive to entitle individuals and ensure they have safety and security. If a PRN medication helps promote safety while working with the individuals, for us, for the individuals themselves, and for others who might be in the area, we should follow the DSW Code of Ethics. So in terms of the scope of practice, we as DSWs have some power over the client's medication. We need to make sure that we are not abusing the power we have been given. We only give them PRN medication if needed, in their benefit and not ours. If the medication will improve the client's quality of life, then they should receive it. However, we always need to be keeping in mind, is this medication for the client, or is it to better my own situation? So as we close up, I'm just going to leave you with a few facts here. There have been a 580% increase in the use of antidepressants for children under 6 in the past decade, which is quite surprising. Antipsychotic medication is the most widely prescribed medication for persons with developmental disabilities with challenging behaviors. 20 to 24% of adults with developmental disabilities are on psychotropic medications, and 14 to 30% are receiving those medications for management of their challenging behavior. So this is something that's quite common in the field, and I'm sure something we've probably all already seen at our various placements or on the job. So just a few more fun facts closing out. They're all listed here on the slide. I'm just going to read a couple of them for you. So for the population under 18 years of age, 35,000 prescriptions are being written annually for antidepressants. So we've seen a marked increase in these prescriptions being given to young children, and you've seen many of our facts include young populations who are getting more and more complicated drugs to affect their mental well-being. So just some student input on our entire sort of argument here, our entire message. This student said that they believe that over-medicating individuals with developmental disabilities and using medication should always be a last resort, and they should be focused on other forms of intervention. Medication is benefiting individuals on psychiatric levels or emotional levels, and that is a good thing. However, this individual says that their beliefs about this issue have been influenced by personal experience being medicated to help better manage mental health, which is a valid issue and something, again, that we will see in the clients we support. Sometimes their mental health needs addressing as much as physical impairments. So thank you very much for listening, and have an excellent day, and we hope you learned something.